At the 2021 third quarter meeting of the Northern Traditional Leaders Committee on Primary Healthcare Delivery on Polio and COVID-19 vaccination, traditional leaders were charged with the responsibility of encouraging their community members to get vaccinated. The United Nations Children's Fund country representative, Peter Hawkins, in his speech, said immunization is not only critical for children, but also for adults. He added that the COVID-19 vaccine is safe and urged the traditional leaders to sensitize their community members on the need to get vaccinated.
Immunization, though, is not only critical for children, but now also for adults. COVID-19 vaccine is our way out of the pandemic. It is safe, it is effective, and the best way to bring Nigeria back into normalcy. It is your role which is indispensable in providing accurate and motivational information and dispelling rumor and misinformation to your people and your constituents. In a world where people can easily get lost in the abundance of information and rumor, you are the guiding light to those communities, and you have demonstrated that already so far. With the Moderna vaccine rollout, we have nearly reached 100,000 per day in utilization. The AstraZeneca has also reached nearly 20,000 per day in utilization. This is a phenomenal success without which, without your support, would not be possible.
Hawkins, speaking on the outbreak of polio, said 120 children have been infected with the disease in 2021, while Nigeria has 70% of polio cases across the continent.
Polio in its various forms, and its environmental polio at its fore, is here with us. 120 children so far have been affected in 2021. Nigeria accounts for 70% of polio cases across the continent. The outbreaks have not only happened in the north, it's throughout the country. And the government of Nigeria and its partners have responded exceptionally well. If I remember the latest figures, 78 million vaccines have already been utilized throughout Nigeria. Another 50 million are expected over the next month or so to counter the outbreak. We're implementing the outbreak response to contain the spread of these diseases, just like when we were fighting wild polio together before. And in the same way, we need to come together to fight this, both the pandemic, the polio, and also to strengthen routine immunization.
Speaking on the long-term solution for polio, Hawkins said all communities have to be protected through immunization.
The long-term solution out of the recurring outbreaks is to ensure that all communities have the protection that immunization affords to them. I plead to you to continuously persuade the community in your Friday sermons, Quranic studies, and other religious fora, in your engagement with your constituents at community level on the importance of routine immunization, of which polio, COVID, and other vaccines are now an integral part of the primary healthcare system that affords to take it.
Also, the Executive Director, National Primary Healthcare Development Agency, Faisal Shuaib, speaking during the event, appreciated the efforts of the traditional rulers in sensitizing and mobilizing its community members for vaccination.
That your paternal guidance over the years has contributed immensely to the modest successes that we have achieved thus far in primary healthcare. The first phase of our strategic COVID-19 vaccine rollout witnessed complete utilization of all available doses of vaccines due to your support in the sensitization and mobilization of the community for vaccination. The second phase, which is currently ongoing, will also require our traditional leaders to champion the cause towards vaccination and ensure Nigeria returns to normal living. We encourage you to use your influence to disseminate the right information and dispel any misinformation on the vaccines.
The executive director speaking on the polio virus said,
"We completed 1 year as a wide polio virus-free country. This achievement is due to the collective efforts of all of you, our royal fathers, steering the boat of leadership to ensure vaccination is widely accepted by all." I would like to state without any doubt that Nigeria's wild polio virus-free certification is not under any threat. I would also like to use this opportunity to once again appreciate His Eminence, the Sultan of Sokoto, NTLC members, and all traditional and religious leaders across the country for the sustained support and continuous mobilization of the community to ensure that we remain wild polio virus free.
Also, Nigeria in recent times has been suffering from various disease outbreaks such as cholera, COVID. The NPHCDA director said a more integrated approach will be carried out to ensure efficient utilization of available resources in order to enhance confidence in people.
With different disease outbreaks that we're currently contending with, it is imperative that our approach becomes more integrated. This is because they are all interwoven. Amidst COVID-19, we have cholera, we have CVDP2 outbreaks. These CVDP2 outbreaks is as a result of suboptimal routine immunization in part of the country, but primarily because of poor water and environmental sanitation. It is therefore very critical that as we conduct our outbreak response campaigns, we need to find a way to integrate our responses for efficient utilization of available resources and to enhance confidence in our people. Integration will also enhance our determination to continue to safeguard our wild polio virus-free status. Mobilization, sensitization, advocacy, and role modeling efforts should target multiple interventions simultaneously.
Shoaib urged Nigerians to continue observing the COVID-19 protocols while reminding those who are yet to receive their second doses of AstraZeneca vaccine to do so now that it is still available in all states across the country. Also, the Emir of Argungu, Samaila Muhammad Mera, has urged Nigerians to get vaccinated, adding that it is safe.
All the responses I had from my colleagues, there is every hope that the vaccine stock we have at the moment will be exhausted, will be taken by citizens of this country. But what we intend to do as a committee is, one, to lead by example. I have taken my 2 shots from the onset, and I believe every member of the committee has taken. And we've also advised and guided our councillors and members of emirate councils to also take. Most district heads and village heads have taken. These are leaders of our community, and the people have trust in them. And being the first to take, we will ginger other followers to also accept to take. Apart from this, we've also been talking to people about what we believe to be the position of the vaccines, that they are safe. COVID-19 is safe. Is in this country, it is dangerous, it kills. And the only cure, the only preventive measure available to everyone at the moment is the vaccine. So we're leading by example. We're also talking directly to the people. We are bringing in traditional other traditional leaders on board. We are bringing in all religious leaders that can influence people to also speak on the subject.